Hello everyone and welcome to another Knowledge Pack episode by Abdos Life Sciences. Today we are diving into a crucial area where the clinical care meets the cutting edge research. That's none other than the world of genetics in pediatrics. I am Dr. Purnima, the host for the session, and joining with us is a very special guest, Dr. Ankur Sethi, the Senior Consultant and Head of the Pediatric Division at Yatharth Hospital, New Delhi. With his years of experience in neonatology, early childhood care, and deep involvement in genetic diagnostics, Dr. Sethi brings the insightful perspective on how this pediatric genetics is shaping the future of child healthcare. Joining us here we have Dr. Ankur Sethi, the Senior Consultant and Head of Pediatric Division at Yatharth Hospital, Noida. So welcome sir, welcome to our session.
Thank you so much. Thank you
so much. He is deeply involved in the early childhood care, development and neonatology, where his expertise offer us a unique perspective how genetics lead to the intersects with the clinical practices. So sir, welcome first to our session here. We would be interested to understand what is the basic behind when we talk of pediatrics and genetic care.
Okay, so the genetics in our department, we start in an antenatal phase. Once the mother gets pregnant, we try to diagnose most of the genetic disorders as early as possible in the fetal life only. And we start with the basic thing, like we go with a detailed history taking, and we try to find out any signs and symptoms which are related to any genetic conditions. And then we start with a screening part accordingly. So the basic screening part start from ultrasound that is done in the first and second trimester of the pregnancy. Along with the ultrasound, if we find any suspicious finding like increased nuchal fold thickness or any absent nasal bones and few other tests, I'm just quoting a few examples. Then we go ahead with the basic testing for the genetic screening, especially for trisomies. We go ahead with the double marker test, we go ahead with the triple marker test, we go ahead with the quadruple marker test, which involve the beta HCG levels and the alpha fetoprotein levels. And if we find anything suspicious, any levels which are increased or decreased, then we can go ahead with a detailed genetic testing, which may involve your chorionic villus sampling or your amniocentesis, etc., so on and so forth. And once the child has gone into the baby has been delivered, and now coming to the pediatric part. So this is the antenatal part that we talked about. Once the child enters, the child is born and we suspect a few genetic disorders in the baby. Again, detailed history, detailed examination, and if we are suspecting something, we can go ahead with the basic karyotyping to rule out a few trisomies. We can go ahead with the whole exome sequencing, microsomal genetic testing.
So this is where you club both the normal examinations with the genetic testings, which are these days coming up with.
So once we have a clinical suspicion, the findings are being verified by all these genetic testing. So once they are verified, we are confident that we are going in the right direction.
So how do you feel like when you have all these tests done, combined with your genetic studies, which are nowadays available with a lot of technological advancements? So how do you feel it's more convincing to the parents, or how do they react to have all these genetic assays with them?
So it's a very traumatic thing for most of the parents if the child is diagnosed with any genetic disorders. So most of the genetic disorders doesn't have any treatment in place as of now. But yes, there is a lot of research going on in that field. But it's very hard for us to deliver the news also. So first of all, whenever we are suspecting something of a genetic problem in a child, we always tell the parent we are suspecting the problem and we need to confirm these things by doing the relevant tests. So these relevant tests can be the investigation that are done in the hospital or the detailed genetic testing which are sent to the relevant labs. Once we get all the results and our findings are verified, we are able to convince the parent in the right manner that what we are dealing with and what is the prognosis of your child in the future. So it is easy for the parents to take the right decision at the right time for the benefit of the child.
So basically these genetic tests and coming up with all these researches in the mall
small bias segment, it's basically giving a edge to the doctors to decide on these
Definitely,
sectors.
it's giving an edge to us. These problems, if we go 15, 20 years back, while I was studying, like I did my MD early, more than 20 years now. So that time we didn't have that much of a facility to diagnose a particular genetic disorder. We were mainly relying on our clinical findings. But once this genetic testing have come up, a lot of labs have come up with a very good and a very ethical and a very detailed testing. So it is helping us to corroborate our diagnosis. So it is helping us in establishing the right diagnosis. It is helping us to give the parents the right advice for the child. And I think this is just one part of the story that we're dealing with. The kind of research that's happening all over the world. So if we enter into the therapy part, the treatment part from the genetic side, it can make a lot of change. It can, take the treatment to a whole different new level.
So as you're marking with the latest research, what according to you is the most, you can say, the edge-breaking thing which is coming up these days?
So I can't pinpoint exactly, but I can quote a few examples. Like if we deal with I'll give you an example of a muscular dystrophy. So there's a muscular dystrophy called SMA. So SMA is it's a life-threatening disease. The child don't survive for a very long during his tenure. But now they have recently come up with a gene therapy, which is available in the market, and the treatment is being administered to all the patients, and it is showing good results. Still, we have to see a lot of follow-up, how this treatment is going to be in the long term. But as of now, what reports we are seeing, it is making a definitive change. Another example I can quote is another genetic disorders we call cystic fibrosis. So we see a lot of cystic fibrosis in the Delhi NCR areas. So cystic fibrosis has also come up with a gene therapy, which is now available in a few countries abroad, but probably very soon it will be coming to India also. And it is making
changing the whole...
Yeah, it's changing the whole scenario, how we are treating the cystic fibrosis patients.
So basically, as we can understand till now, we are having a lot of benefits coming up from all these tests, combined with obviously the efficient doctors taking up all these things further. But every field, whenever comes with a new thing, it comes with a few challenges, ethical issues, and those kind of scenarios. So what is your take on that?
So every research, whenever we start a research, you set the right ethics. So we start our presentation. First presentation is being done to an ethical committee.
Okay.
So the challenge, most of the challenges that we face is to convince the ethical committee that we are doing the right kind of research. So ethical committee consists of a lot of members from different specialities, and they analyze your whole paper, they analyze your whole research, and if there is any ethical dilemma over there, they state it to the researcher, and they are asked to modify their research accordingly.
So here the role of number of these researchers, clinicians, as well as the hospitals or the institutes, that's again a combined effort.
That's again a combined effort. So every hospital or a good institution, wherever the researches are happening, they have their own ethical committees. So ethical committee is very stringent in taking a decision. And there are a lot of ethical committees who are working independently also. So any researchers or clinician who is trying to do a research in the field and they don't have access directly to a ethical committee of any hospital or institution, they can approach independent ethical committees also. So once that clearance is done, then only we go for the research further. And once the research happens, it's not a single institutional research. Whenever the recommendations are made or anything is made, they combine a lot of researches from different institutes. And then there are a lot of committees or bodies which are there to assess all these researches. That's why it's called a multi-centric trials, randomized trials which are happening all over the world.
So basically research is progressing in this way along with a lot more which we are doing in the medicine field to come to some conclusions.
Yes. So the collaboration is always there.
Yeah.
So the collaboration of the clinical research and the lab research which are happening, they always collaborate. So whenever they collaborate, the results are not better, they are multifold times better.
So that means if we talk of the future, so how do you see standing today and might be 5 to 10 years later, since you are into this field
Yeah.
since long, so what do you think, like, what could be the future of this pediatric genetics going ahead?
I think the future is very great the way the research are happening. So the earlier we catch hold of a disease, the earlier we can intervene and we can make a change. So we are hoping that a lot of diseases which are in which the treatment is still not available, and the way research is progressing, we might be able to see a lot of treatment in a lot of diseases that we are thinking कि भाई इसका कुछ नहीं हो सकता, we can't do anything with those things. So I think we see a very bright future the way research is happening.
And even I think nowadays, with all these educations, with all these things coming up to the common man, these things are more accessible to parents. Even how they are taking it.
I'll say the awareness is rising everywhere. So it's not only the awareness which is increasing among the clinicians or the researchers, the awareness is increasing among the parents also. So the most of the parents are aware about all these things. There is a thing called a genetic thing. We should not miss out on that. If the clinician is suspecting, then we should go ahead with the genetic part. The accessibility is very easily now. It's very easily accessible to most of the people, even in the government and in the private sector, both. So I think it's just the part of the awareness which is
rising
a lot.
Because that since we have the technology, if we have the medicine, but if we don't have the right knowledge and the right distribution of that knowledge, then that's the lacking part only. But
So
right now in India, at least we think of
so the pediatric genetics department is developing most of the good institutes. Like I can quote a good department in the Gangaram Hospital. I worked with that department. So they are doing a lot of things which we don't even think of. And another good example I can quote from government college is the AIMS Delhi. They have an excellent department of genetics over there. So it's helping us a lot. And it's not only pediatric genetics. I think the way the treatment is happening, it may make a lot of difference in the adult treatment also. In some of the diseases in which we think they should be on a long-term therapies, if any gene therapy or something that's similar to that comes, it can shorten the treatment part and can improve the life also.
Have there any tests which, as you mentioned, for the government sector also, have there certain tests which they have like put in compulsory for these kind of tests not yet?
So one of the tests that we are promoting these days, not a compulsory I'll say, but we advise to almost every newborn, is the newborn screening. So we screen most of the metabolic disorders. It can cover your carbohydrate metabolism, fat metabolism and protein metabolism. So a common example is your cystic fibrosis, your G6PD deficiencies, phenylketonuria, and so on and so forth. So this is a very good test. I think we advise almost every newborn to go ahead with these tests, and I'll say the positivity rate is around 5%. So in the 5% of the cases, we catch hold of a few things, and suppose we catch hold of a G6PD deficiency. So G6PD deficiency patient, the only thing they need to do is to take a few precautions. They need to avoid a few drugs whenever they go to a doctor, and the child can lead a normal life. But if the parents are not aware about that deficiency and the baby gets a drug which is which can induce a problem, that can be a life-threatening problem. So that is how the impact is.
So it means that both these things are in collaboration, giving a lot to the humanity if it comes to even since your childhood, since your childbirth, and even before when you are into your motherhood.
Yes, totally agree on that. Totally agree.
So it was immense knowledge which we had today. Because since we are from the background where we talk of research, we talk of clinicians, diagnostic tests, but coming up all these things from a doctor itself gives us that passage where they both club together and give this all to the children.
I'd just like to add one more thing in that. I think our country needs to focus more on the R&D part, the research and development part. I think we are still lacking in that, and we need to focus more on that. And the way you are saying, I hope your company is doing a lot of research, and my best wishes to you.
Thank you, sir. Thank you so much for joining us on this. Thank you.
Thank you so much for having me.
Thank you.
What an eye-opening discussion on the evolving role of genetics and pediatrics and child health. Whether you are a clinician, a researcher, a student, or a curious parent, we hope you gained the valuable insights through this. A big thank you to Dr. Ankur Sethi for sharing his experience, insights, and the hope for a future where early diagnostic and gene-based treatments can change lives. If you found this conversation valuable, do not forget to follow us for more such expert-led content at the intersection of science, diagnostic, and innovation. Until next time, thank you for watching and let's keep advancing science with quality. Thank you.
Abdos Life Sciences. Advancing science with quality.